welcome back. I figured by this point I had posted my video about my disability and requiring oxygen, so I figured we could do story time as I drive to my rural hospital. I'm going to tell you how I became oxygen dependent. I had multiple underlying health problems, ankylosing spondylitis, ulcerative colitis. I had a stroke. I would get pneumonia once a year at least. I had sepsis multiple times. When I got COVID in 2021, it almost ended me. I mean, I was in intermediate care, respiratory failure. I really was facing getting intubated and having to go on a ventilator because of my respiratory failure. But every time I would recover, I would heal and get back to my baseline. But as time has gone on, it became harder and harder to get to baseline after a bout of pneumonia or sepsis, C. diff. Every time it would just become harder to get back to that level. And back in 2025, it was January, and I woke up with a fever and body aches, and I had this pain right in my upper abdomen chest area on my left side. So I'm thinking, oh my God, I'm having a heart attack, I'm having heart failure, something's wrong with my heart, I can't breathe, I have this pain. So I go and I see my primary doctor, and he's able to actually get me in pretty quick. And I'm like, man, I have this pain that just radiates across this strip on my back to my abdomen and chest on my left side. It's like, he's like, well, I know what that is. You have shingles. I'm like, So it was one of the most painful experiences I could ever describe. I mean, I thought I was dying. So I have shingles, and so he starts me on antiviral for that. He's like, well, the fever, the cough, your shortness of breath, all these things are concerning. Let's get a viral swab, PCR, just to make sure you don't have anything else going on. I do. I have flu B. So he calls me and says, hey, you have flu. We've already put you on a cyclovir for your shingles. I'm going to call you in some Tamiflu, and probably need to start you on a Z-Pack because your heart rate's a little elevated, and I worry about you getting sepsis again, pretty much. I know it's viral right now, but with your history, I think we're cautious and start you on Zithromax. Sounds reasonable. No, I mean, I take maybe one dose of Zithromax. I wake up the next morning blue. I mean, can't breathe, starving for oxygen. Put a pulse ox on. I'm like 78, 81 in that range. And I don't have oxygen at home at this point. So I'm like, oh my gosh, I gotta go to the hospital. Now, someone that their brain's functioning normally and has the oxygen it needs would be like, oh man, my oxygen's really low, I should probably call an ambulance. Not this guy. In my hypoxic state, I'll drive. I don't want to bother an EMS crew. I'm fine. I'll drive. So I drive to the hospital, which, if you're hypoxic in the 80s, in the 70s, please don't drive. Just be safe. Don't do what Patrick did. So I drove to the hospital, hypoxic. Looking back at it, I don't remember most of it. I got to the hospital, I check in, I'm like, oh, I'm really short of breath. And the nurse kind of looks at me, I don't think she really believes me. She's like, okay, have a seat. And so I go and I sit down. Again, hypoxic, probably a little loopy and out of it from the hypoxia. I go sit in the chairs, and about 4 or 5 minutes later, I mean, my nail beds are blue. I mean, I'm very hypoxic. She calls my name. I stand up, almost hit the floor, kind of stumble in there, and she probably thinks, oh gosh, what is this guy on? And I'm like, oh, I'm having trouble catching my breath. I've had the flu. I just don't feel good. So her concern isn't, oh, let's see what your oxygen is. She's like, oh, put this mask on. So I put this mask on, and then she starts putting all the vital sign stuff on me, the pulse ox, the blood pressure cuff. And then it just goes beep, 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 going off. And she's like, are your fingers cold? And I'm like, no, it's like, oh, just take some deep breaths. I'm like, I'm trying. And it's just beep, beep, beep. It's like 78, 77. And she's like, well, let's try this other finger. I'm like, okay. And again, I'm being compliant. I'm hypoxic. I'm there for the ride at this point. It was an experience. And so she's finally like, maybe this is right. So they call the doctor, and they're taking me back to a room. The doctor comes in and sees my pulse ox at like 77. I'm not on any oxygen at this point. And she's like, why haven't we started him on oxygen? Where's the respiratory? It's like, she can clearly tell I'm sick. She can tell that I'm out of it, like that this is not my baseline, that I am just not myself. I have a good history with this hospital. I've probably seen this doctor before. I don't even remember who it was. But my primary doctor admitted to that hospital, so good relationship with the hospital. So they give me on oxygen. I'm on like a non-rebreather at that point, and I perk up. I remember things clearly now. I get ABG, I get blood cultures, they do a chest x-ray, and she comes in there and is like, your chest x-ray is horrible. You have bilateral multifocal pneumonia. So it's like, not only do you have the flu, you have pneumonia in about every lobe of your lungs. And granted, this is a 24-hour progression since I saw my primary doctor, and I was not this sick the day before. If I was that sick, he would have been like, oh, we need to send you to the hospital and get a chest x-ray. He would have. He's a good doctor. But I had just progressed super quickly. And, she's like, if you have more trouble breathing, do you want us to intubate? Had the full conversation of what happens next if things don't turn around. That's a scary conversation to have. So I'm like, yes, I'm full code. I want everything done. I'm young. I'm fairly healthy. But I have a lot of life to live. So no, I don't want to throw in the towel and have comfort measures. I want you to do what you have to do to keep me alive. So we have this conversation, and they get me an intermediate care bed because I'm on a lot of oxygen. And also my blood pressure was taking. I was septic, so I was getting a bunch of fluid, which led to another issue. Now I'm volume overloaded with pulmonary edema on top of my pneumonia. So I'm getting diuretics. Go to intermediate care. My doctor admits me, which I'm always thankful for. It's such an amazing thing to have your own doctor be able to take care of you in the hospital. But he comes, his team takes care of me for the week. I'm in the hospital for, I want to say 10 days. It was a while. The first few days I was on pressors, fluids, a lot of oxygen. Eventually I was able to get to a nasal cannula and down to about 4 liters. The plan was to wean me off the oxygen and discharge me home. And by day 8, I think his partner was taking care of me by that point because it was the weekend, he was off. And his partner was like, hey, I think we need to have a conversation that we might not be able to get you off oxygen before we discharge you home. And I'm still thinking, oh, it's just going to take a little bit longer. Okay, yeah. And I think I even said oh, so how long do you think I'll be on oxygen? And he's like, oh, some people, it could take a few weeks. It's just something that we'll have to watch. But, we'll wean you slowly. It's like, I just don't think we're going to be able to do it in the hospital. Your oxygen demands are just too high. but you are stable enough to go home soon. He's like, we'll have infectious disease, transition you to oral antibiotics. We're going to get a chest x-ray, make sure you're stable. And hopefully by Monday or Tuesday, your doctor will come by and we'll be able to get you home and get home health and oxygen set up. Fine. So my doctor comes Monday, and we have a similar conversation. It's still, oh yeah, some people, especially with like COVID and stuff, and sometimes pneumonia, they just can't get off oxygen all at once. So it takes their body time to recover. And you have so much inflammation, so many things going on. It's not unusual that you're needing extra support. Okay. But I mean, I'm pretty sure he did say, but lung tissue can be damaged, and sometimes this damage is permanent. So we're just going to have to monitor it. We're going to have pulmonology see you and follow up once we get you outpatient. So I go home after, it was at least 10 days I was in hospital. It might have been 12, but it was later that week. I think I went on like a Thursday or something, and I get a dozen oxygen tanks delivered to my house, a portable oxygen concentrator, a mile of tubing, and I mean, I'm on, I want to say I'm still on 4 liters, it's 3 or 4 liters constantly. Like, I couldn't take it off to go to the bathroom. Like, if I take my oxygen off at that point, my oxygen would just tank. I mean, like, woozy, pass out phase. And that goes on for 8 weeks. I feel bad, and I feel like I should be progressing. Why can't I get rid of the oxygen? Why am I not making progress? And my doctor's like, well, sometimes it just takes time. And I mean, the goal was to go back to work when I get off oxygen. And after 8 weeks or so, that wasn't the goal anymore. I mean, it was, can we lower your oxygen demands to the lowest amount possible? And the conversation starts shifting to, this might be long term, you might need oxygen the rest of your life. And that was a very hard thing to accept. And I think I still struggle with it. But it was very difficult to accept that this was not something I was going to recover from. That this was going to be my new normal, my new baseline. And that it was the flu. Like, I had gotten the flu. I mean, it was a confluence of events that sucked. I got shingles, the flu, and then pneumonia, and then sepsis. But there was nothing I could do about that. I mean, so that's, I think one of the things I always try to tell myself is, let's worry about the things I can control and manage the things I can't the best I can. I mean, I'm not going to be able to do anything more than what I'm doing right now in regards to that. If I can't make my lungs better, I can't control that. So it was very hard adjusting to that new normal. And I think I still struggle with the acceptance of that even now. And I think that's why I don't want to have to wear oxygen. I don't want to be perceived as weak or disabled. I think part of that's the acceptance thing. I think, I don't want to be discriminated against. I don't want people to look down on me or think that I'm less because I require oxygen, because I have a disability. So it was and still is a hard thing to get used to. This story time went way longer than I expected. I guess it took a little longer to tell that story than I was expecting. But that was over a year ago. Gosh, a year and a half ago now. It's hard to adjust to what you dealt with. So always try to put this into perspective that I'm so blessed that I have 4 kids and a wife that are there. They're amazing. And there's so many things going well in my life that I need to focus on those. Because if I focus on the negative, it will only breed more negative. So I really try to look at the bright things, the happy things, because I really do believe the more you feed the good, the more good you will get. The more you feed the bad, the more bad you will get. So I try not to feed the bad. I try to focus on the good and the more good I can put into the world, I truly believe the more good that will come back to me. So, well, I'm going to go try to do some good. I hope everyone has a great weekend. If you have questions, if you want another story time, I got others. I can tell you how the COVID experience went. That was definitely an adventure, but let me know what y'all want to hear. I'm almost to my rural hospital. I will let y'all know how this weekend goes. Y'all have a great time. Bye.